Hi, thank you for joining our live. My name is Omina Morin. I am a clinical officer at Jacaranda Maternity, specifically in Ngong Road branch. And I'm also the high risk coordinator for the Ngong Road branch. So this is the voice behind the high risk clinic. And we'll engage more. So today we are discussing about fibroids. It's a struggle for women who are under it's a struggle for women. So major questions asked are like what are fibroids? So we'll be discussing it as we continue. Number two, if you have any questions, you can put down on the chat below so that we answer as we continue with the live. So what are fibroids? You see, the discussion about fibroids is all around. So fibroids, in a layman's language, these are just growth in the uterus. It can be anywhere. And you know the uterus has three layers. So it can be growth in the uterus, can be small or big, can be as small as a lugwort, and it can be as big as a watermelon. So depending whichever size. So those are fibroids. And one thing you should note that fibroids are not cancerous. Yes, they can be cancerous, but there's little percentage about that for it to be cancerous. So what we term it as in the medical field, we term it as benign. Fibroids are benign. So other questions that may come about is a mom will ask you that what are the main cause of fibroids? So the main cause of fibroids is just the female hormones that we produce as women, mainly the estrogen and the progesterone, okay? And even if there's any familial history of fibroids in the family, you may find out that if your mom had fibroids, you as a person will also develop fibroids, okay? And even growth factors within the body. And even fibroids themselves, they tend to grow more in the reproductive years of a woman, okay? So another question that a mom will ask is that who is at risk of developing these fibroids? The people who are at a higher risk of developing fibroids, as I had said earlier, the person, if you have any, for example, a mom, your mother or your sister has fibroids, there's that genetic factor that you may develop the fibroids. So the risk is usually between 30 to 50 years. And also people who are overweight or obese, they tend to develop the fibroids. In case you start your periods at an early age, you may also develop the fibroids also. And if you've never given birth through your reproductive years, you are at risk of developing fibroids, okay? So what are the major symptoms and signs for fibroids? You may experience heavy menstrual flow, unexplained heavy menstrual flow, or prolonged periods. For example, if you're used to getting 3 days of your menstrual cycle, you get it increases to 5 or 7 days, and this you may see that the pads are fully soaked. Another issue is you may feel pelvic pain. Pelvic pain is the lower side of your abdomen, or you may feel pelvic pain or pressure, just pressure on your lower part, okay? And some lower back pain that are on and off. And also another symptom is you may have pain when having sexual intercourse with your partner, frequent urination, also sometimes constipation. You have the urge to poop but the poop is not coming out, and other symptoms may be like you're having difficulty to get a baby or to conceive. Can you have fibroids but you don't have the symptoms? Yes. Sometimes it's just a coincidental finding that you find out when you do a pelvic scan or a pelvic examination, okay? So not every fibroid that you have may cause symptoms. Can fibroids cause heavy menstrual bleeding? Absolutely. So this is a common symptom for you to have fibroids. Even when you come to the facility and you tell us that my menses are usually heavy, the number one factor that you think about is fibroids. So can fibroids cause pelvic pain and back pain and frequent urination? Yes. Large fibroids can press against your nearby organs, especially the bladder, and you may feel the urge to urinate more frequently. Can fibroids affect fertility? Yes, depending on the location and size. So fibroids inside the uterine cavity can interfere with the implantation, making it harder to conceive. But sometimes you may find out, despite that you have fibroids, many women can conceive with with the fibroids itself. You can still get pregnant naturally. Another question is that, can fibroid cause a miscarriage? Yeah. Especially those ones that I had said earlier, the ones that are inside your uterus, making it hard for you to conceive. They can cause an earlier miscarriage. That's why if you have history of pregnancy or frequent pregnancy loss at your first trimester, it's usually important for you to get checked up, okay? Can fibroids affect pregnancy? Yes. Possible complication, as one that I had mentioned earlier, is like you may have miscarriage, especially the ones that are in the in the inner uterus lining. They can cause someone to go into preterm labor. Depending on the position of these fibroids, they can cause the baby not to have an abnormal lie or an abnormal position of the baby, okay? And sometimes they may cause something earlier separation of the placenta from the uterine wall. This is known as a placenta abruption. So with all this, they may cause a likelihood of you delivering via a cesarean section. Many women may experience they have fibroids, they are pregnant, but we still go up to term and they deliver via vaginal birth. Okay, how are fibroids diagnosed? So fibroids are diagnosed medically and through an ultrasound and even through a pelvic examination, depending with the type of fibroids that you have, either they are, or the size, basically. If they are miniature or they are larger, but through an ultrasound, they may be seen, okay? Do all fibroids require treatment? No. If a fibroid is small and not causing any symptom, you will not necessarily have any treatment. But if the fibroids are affecting your fertility and you feel as a mom that these fibroids are affecting me in such a way that you cannot be comfortable, definitely they require treatment. So what are the available treatment options? So treatment will definitely depend on the symptoms, size and location of the fibroids, your age, definitely, and if you have any future pregnancy plans. So, and the options include medications, hormonal therapy. You remember that we said that the fibroids themselves grow because of the presence of estrogen and progesterone in the body. So there's something called uterine artery embolization. We remove the uterus. So we remove the fibroids. So this can be either through laparoscopy or through laparotomy. So laparoscopy meaning through it's a minimal invasive procedure which we do as Jacaranda Maternity, or we just do an open procedure. Okay, and then there's the other part. If you find these fibroids are large and they are numerous, there's a part whereby we come out with the whole uterus. Can fibroids be treated without surgery? As we say that there are some medication that help with pain, but they're just to manage, but not to treat as such. Okay, so you may I've mentioned about myomectomy. So what is myomectomy? It's a surgery to remove the fibroids while leaving the uterus intact. This definitely is an option that you would prefer if you're in your childbearing age or you would wish to conceive in your earlier years. So what is a laparoscopic surgery? This is a minimal invasive surgery whereby you just have small cuts, but this is dependent on how large these fibroids are. There are fibroids which are the size of a watermelon. That one you cannot remove via laparoscopic. So this one, it will all be dependent via the size of the size of the fibroids. So what are the benefits of a laparoscopic surgery? This is less pain because it's just pin size, camera hole size type of surgery. You have smaller scars, and then you have a shorter hospital stay, and also it has a faster recovery. Can fibroids come back after treatment? Yes, because we've said that they are dependent on the hormones that you have in the body, the estrogen and the progesterone. Even if you have a successful removal, new fibroids can develop even before menopause. So regular follow-ups, even after the removal, is very important. Can fibroids shrink on their own? Sometimes they can't shrink on their own, especially when you've reached past menopause. The body tends to reduce on the hormonal levels. So hence, if the hormonal levels are going down, definitely you will expect the fibroids to go down. So they'll just shrink naturally over time. Can fibroids be prevented? Yes, they can, by doing regular exercises. If you're heavyweight, you try and lose hair. You at least you work with your BMI. You eat fruits and vegetables frequently and limit processed foods. Okay. What foods should women with fibroids eat? We encourage women to eat fruits and vegetables, whole grain, beans and legumes, iron rich such as spinach, liver and beans. Remember that we say that if you have fibroids, you have a tendency of bleeding out, of bleeding, not bleeding out, or bleeding heavily. So if you have a tendency of bleeding heavily, definitely your iron levels will go down. So this you replenish by eating iron rich foods such as spinach, liver and beans. And you also limit the eating of excess red meat, sugary drinks, and high processed foods. What happens if fibroids are left untreated? So one of the things that I had mentioned is that when you have fibroids, is that you will have heavy menses, and this will cause you to have severe anemia. Anemia is lack of iron in the body. So this will cause you to have severe anemia, chronic lower abdominal pain, and some females present with fertility problems. Yes, you get pregnant, but you end up with a miscarriage. Pregnancy complications, which are the ones that I had mentioned, like placenta abruption, the early separation of the placenta from the uterine wall, and pressure on your bladder and bowel. So when there is pressure on your bladder, you'll have frequent urination. Pressure on your bowel, you'll experience sometimes constipation. Good. At what size should the uterus be removed? There is no specific size for a uterus to be removed. It all depends with the patient's preferences. For example, you have a fibroid, and it's a small one, but it keeps affecting your pregnancy. We usually advise for the removal of the fibroid first before we go back to at least trying to get pregnant. Even you may have a small fibroid, but it's causing very severe symptoms, and you will have a larger one that's not causing any symptom. So decision is mainly dependent on the symptoms, fertility goals, and the location of the fibroid. Can fibroids disappear after menopause? Yes, they can disappear, but mostly they cannot disappear, but they'll just try and shrink from the original size, and they become smaller and no longer cause symptoms. That is after menopause. So one of the questions is that during delivery, the doctor told me that I have fibroids. Yes, I had no symptoms. Yes, you may have fibroids, but you may not have symptoms. We said you may find fibroids coincidentally, like you're just coming in for a routine checkup, and you find out, oh, so you have like a small fibroid. So basically, sometimes these fibroids that they do not give you symptoms. They just come up as a coincidental finding when you are doing what? An examination. Or, for example, if you are doing a C-section delivery and the doctor finds a fibroid, they're obligated to tell you that we found a fibroid, and they tell you the location. Okay? How early in terms of age can someone get fibroids? So long as you are in the reproductive age. Reproductive age means that you've started your menses. So that is a reproductive age. You started your menses means you are sexually fertile and if you are sexually active. So from that time onwards, you can still get fibroids. After removal, what are the chances of them occurring? It's a 50-50 chance, because we still have the other parts of the uterus being there. Despite the fact that we have removed them, we still have a chance of them coming up again to another location, despite them that you have removed them from another location. That is why we say that it's basically you try and prevent the occurrence of fibroids by ensuring that you have a proper diet, limit processed foods, and have a good weight, have a good BMI. Another question. And point to note is that exercises also can help with fibroid symptoms if you maintain the healthy weight. So it can help. Okay. I took fluconazole without knowing will it affect the baby. Depends on which trimester are you in? Which trimester are you in? Because first trimester. Okay, so most of the time we discourage giving this medication in the first trimester, dependent on the dose. Most of the time it doesn't give that severe or adverse effects to the baby, so long as it's not a repetitive drug administration. What you can do at 20 to 24 weeks, we do something called an anomaly scan, whereby we check for any fetal anomaly. That's where you can, if it affected the baby, sorry, but rarely. So constipation might not be a digestive issue. Yes, it might not be a digestive issue. It might be a reproductive issue, because we've said that if you have a fibroid as large as a watermelon, it will the uterus itself, it's adjacent to the bladder and the bowel. If you have a very large fibroid, it will lean on the bladder and bowel. So sometimes these are symptoms like constipation or frequent urination may be associated with this. I'm 3 months pregnant, but on my left side and under the stomach is painful. So 3 months, we expect you to be between 8 to 11 weeks pregnant, right? You feel pain on your left side. It's your lower side, or is it the upper side, or is it the middle part? And under the stomach, it's painful. One of the things that comes up in pregnancy is that the more the baby grows, the more like organs are trying to be squished or squashed, or just they try to overlap themselves. So one of the things that comes up easily is that, or high acid reflux that may come as a result, then unaona uko na hiyo stomach pain. So this my left side pain, is where is it? Is it on the lower side, upper side, middle part? How often does it come in? And what is the severity of this pain? Had my CS there on Feb. Every time I press, there is pain. Oh, sorry about this. Come each and every time that you press there's pain. We can come in and have a checkup. We see how healing is being is there. One of the things that comes about is that CS takes it's a healing process for some months. So we'll come have a checkup. You can just come in and say, I just have a query. We come and check up. We see the scar, and probably we do a scan just to see internally how the scar is healing also. I have a 5 times so posterior fibroid. Can I conceive with it? One of the things that you need to know, where is it? Is it on the inner uterine wall, or is it on the outer uterine wall? Because most of the time you find out that the fibroids that take hard for you to conceive are the ones that are inside your uterus. If it's outside your uterus, the chances of you conceiving are high. But when it's inside your uterus, that's where you'll find out that for you to conceive, it's kind of difficult. Can I use Depo when my child is 2 months? No, we cannot use Depo when a child is 2 months. Depo, we only use it when a child is 6 months. This is because there are products that in the Depo injection that will end up in your baby's lungs, because that Depo injection will pass through the baby's milk, through your breast milk, and through your breast milk, the baby will take in, and then it will affect the baby's lungs. Number 2, it also affects the outtake of your milk. So for under 6 months, the sort of family planning we usually say, either you do lactational amenorrhea method, whereby you breastfeed entirely. That is also a form of family planning. Or you take only progesterone only pills that we usually give, you take each and every day. But for pills like Femiplan, those ones we give past 6 months, because after 6 months at least the baby starts eating. But for Depo, don't be injected Depo if your baby is 2 months. Wait for the baby to reach 6 months. How many children can you have on CS? So this is user dependent, but us medically, we usually advise the higher the number of CSs you have, the greater the risk that you have. You can imagine, and each and every CS bears the risk twice than the other one. So you shouldn't even go beyond the 5th scar. That is my take. Is it safe to use due date of the scan? Yes, and it is safe to use due date of the scan if you've done it in the first trimester. There's that scan at Jacaranda Maternity. There's that scan that we say a dating scan at the 12th week, a dating scan. So that helps with us knowing when are you able to deliver, so that we even plan. If you are a previous car, we plan and say, for you, if we are going in for another CS, or if you are going vaginally, then by the time we reach third trimester, you already know when is the time that you are about to give birth. Does breastfeeding shrink fibroids? No, breastfeeding doesn't help shrink fibroids, because the hormone that is made for fibroids is not the same one that is made to help in the secretion of breast milk. Okay, 3 months process. Now the incision is still hard. Is it okay? Yes. Healing takes time. The only thing that is not okay when you are having a lot of pain on the incision scar, pus is coming out, or the incision scar is opening up. That is not normal. But you can come in, we do a scan and see how the healing is occurring underneath the scar. Okay. My child cord is not down. I gave birth on June. Sorry about this. You can come in and then we see how the cord is, and then we see how the cord is healing about. There are many reasons why a cord may have not fallen off, but you can come in so that you can be seen by a pediatrician and see how we can go about that. For Ngong Road, our clinics are on Tuesday for pediatrician, Tuesday, Thursday, and Saturday. And for Saturday, it's from 9 to 1. Infection. Oh, so which type of infection? Is it a UTI? Okay. So how many days of this medication did you take? If it goes, at least by the time we reach the third day of medication, you should get some improvement. If not getting improvement, please come back for a review, Mama. I had a siesta and lost the baby on 8 months. Which is the best way to give birth? I'm sorry about this, my dear. So first of all, you really need to know the reason why you lost the baby at 8 months. There are many reasons, including pressure and diabetes. And at Jacaranda Maternity, we hold a clinic called High Risk Clinic. For any mother who has lost their baby, try as much as possible. For your next baby, at least you go with your bundle of joy at home. So this is what I can encourage you to do. Come to Jacaranda, even your preconception. We discuss, have a good discussion around what happened, probably, so that you at least pick up. Even when you have conceived, we start the clinic with a gynecologist, a high-risk coordinator. Probably our Ngong Road branch, for Ngong Road branch, we have our high-risk clinic on Tuesday and on Sundays, so that we ensure that this bundle of joy, for this time round, you go home with your bundle of joy. So, for example, in this case, you had your baby through CS. There's something called vaginal birth after cesarean, but it carries also a risk. So I will just advise you to go for the CS because you have a previous scar. How painful is HSD? And if the tubes are blocked, can you request them to flush it on that day? So if the tubes are blocked, it means that chances of you getting pregnant are low. So most of the time, we usually advise for IVF, or you try as much as possible probably to get them unblocked. But surgery, it's a 10% chance for you to get pregnant. And yes, HSG is very painful because it's a dye that is being injected to your uterine cavity so that we can see your uterus and your tubes if there's any blockage. If you can come in for a review with our gyna, and then we can discuss this on deeper states. I gave birth 10 months ago via CS and I haven't gotten my menses. It's very okay. It can even go up to 3 years for you to get your menses. But I hope you have a family planning method with you. Menses can start as early as 6 weeks, or even can go as late as 3 years. So long as that you're not pregnant, they can still delay. But period zangu hazijarudi, naweza pata ball tena. Yes, wala family planning utapata ball. So that's why they usually say there are various methods that you can get for family planning. Especially after delivering, you are still fertile, and you may not quite be sure on what time your menses may come back. So we usually offer a variety of family planning at Jacaranda. You can visit us for the family planning services. You just come in and say, I would like to see a nurse for family planning services. Good. That's a very good question. Non-hormonal FP ni gani? So non-hormonal include a condom, and also includes withdrawal method. And also we have a coil, a copper coil that is non-hormonal. Had 3 miscarriages, any FP please. Also, sorry about the miscarriages. When were they happening? That is one. When were they happening? At what stage? Were they less than 12 weeks happening? And to which, how frequently? And were they following each other? You had this miscarriage, then this other one, then this other one. What are your future plans? Do you want to conceive again? For family planning, it's user dependent. We have short term and we have long term. Short term includes the depot, the oral pills that you take daily, and long term includes the implant that we put and the coil that we put, okay? And we also have permanent. Permanent includes bilateral tubal ligation or male sterilization. So for family planning, it's user dependent. Visit any of our branches and see a nurse so that you can discuss further about the family planning. Baby's cord hasn't fallen off in 3 months. Is it okay? This is not okay. Kindly visit any of our branches to see a pediatrician specifically for we see what's wrong. Okay? Is it advisable to massage the siesca? Not roughly, but you really want to do it roughly. That is one. You can massage the siesca, but just lightly. I see sometimes people advising us to use shea butter. It's still okay. Ifas imenishinda, same na pregnant care. Vomiting ni worse. Akipole mama uko. But if these supplements are making you worse, we are having gummies that are iron-less. You see, for this one, I know it's the iron that's making you to vomit. What you do, if you're in Ngong Road, just come and say that you want to see Omina. We see how we can help you out, okay? Another question. If niweke coil during CS, hizo bleeding haiwezi. If niweke coil during CS, hizo bleeding hapana, haiwezi songesha wala kuitoa. Haitaitoa mami. Ukiwa na cyst unaweza za kama uko na cyst ile ovarian cyst, we look on how big the ovarian cyst is, but there's still chance that unaweza za. If you're pregnant, you give birth. Mtu wa cyst anaweza pata mimba. One, depends on the location of the cyst. Two, how large this cyst is. These are the dependents of especially the ovarian cyst. You see, every woman who is fertile, at any point, they usually get the ovarian cyst. And there are 2 types of ovarian cyst. There's the pathological one and there's the physiological one that hata we mwenyewe huwezi jua sometimes ikitoka. So it's very good even when you sali unapata uko na shida ya kuconceive, you come to the facility, okay? Mtoto wako 6 months na CS imefura, kuja tukuangalie mamangu. Kuja tuangalie hiyo scan inakaaje. So we'll do a scan just to see inwardly. Tuangalie inwardly kama imepona vizuri. Sasa mamangu. Aya. Nimemeza P2 inaweza affect mtoto ako 1 month, sitaki kupata ball. Iwezi affect mtoto but itaku affect wewe. Itaanza kukusumbua na menstrual cycle yako. Please visit any of our branches for family planning method and advices. Heartburn inanimaliza 28 weeks. That's okay, my dear. It's not okay. So these are things that will come up when the pregnancy gets bigger and bigger. So visit any of our facilities to pay at least kadao. Can never reduce your hyperacidity. We usually call it hyperacidity. Yes, we can do BTL during CS, so long as you just tell the doctor so that you can sign in the consent in advance, so that even the doctor, when he or she goes in, knows that, yes, we are doing a CS and a BTL. 9 weeks postpartum looks like I'm 8 months pregnant and too much gas, painful stomach. Oh, this is my advice. Try and look at the things that you are eating. I know at this point you really want to ensure that the baby has feeds, and by feeds, breast. Most of the time, you try eating these legumes. Legumes go consistently with gas. So you ensure, even if you're eating these legumes, soak them and then wash them again so that you don't get this excessive gas. And a painful stomach too, sorry. I think this is secondary because of the much gas that you're having. The stomach will go down. Did you deliver via normal or CS? Yes. After kujifungua, can I still take pregnant care? Yes. You are ought to take pregnant care up to 6 months. The reason why you are taking this pregnant care is because you want to ensure that you have iron supplementation in enough. And the reason why mostly you see your hair is falling off is because when the iron levels go down, the hair starts falling off. So to prevent this, you ought to take your pregnant care or any iron supplements up to 6 months, okay? Normal delivery. Don't worry, just continue breastfeeding the baby. You'll find out that the katumbo will go down. Pole pole too. You do tube ligation during CS? Yes, we do it. So long as you tell us in advance that when doing the CS, I'm going to do a bilateral tube ligation. We do it so that we sign the consent for two. Another question, naweza pata mimba lini? I just got a stillbirth in 2023. Nikafanyiwa CS. I am diabetic. Hi girl, I'm sorry about this. Come to Ngong Road and we'll try and help you out with the delivery. If you had a stillbirth in 2023, lifanyiwa CS, that one is okay. At least 3 years have passed. At least you can get pregnant. And first you need to be follow up with a gyno because pregnancy itself, there's a risk of you getting gestational diabetes. Already you are diabetic, so the chances are higher. So at this point, you have to be followed up with a gyno plus a high risk coordinator, which we have at Jacaranda. At 8 weeks, is the option better between biofolic and pregnant care? All of them are okay because even pregnant care has folic and biofolic has folic and iron. So still okay, you can take it. But if you have issues in regards to vomiting and having the issues of nausea, biofolic is better in terms of the palatability. This one. A mother with a BP 170/80, can we give depot? No. Any issues with hypertension, we don't give hormonal family planning. Okay? We don't give. Mtu anza kliniki ya ball lini, immediately you notice you are pregnant. Hata kama ni 2 weeks, you come. Hata kama ni 1 week, you come. We start the clinics. The earlier the better. Nilifanywa CS 2023. I'm diabetic. When is the right time to conceive? You can't conceive again. You come, make sure that you are followed up with a gyno and a high risk. Encourage you to come to Ngong Road. I'll follow you up. Is it safe to get pregnant 3 months after losing a baby at birth? Getting pregnant, definitely it's when you've decided you are okay getting pregnant. It's okay. There's no timeline for you getting pregnant. And I will advise you this. You come first so that we do the preconception. And then even when you conceive, at least you are followed up with a gyno. And even during your antenatal visits that you are followed up with a gyno, a midwife, and a high-risk coordinator so that we ensure that you go with the baby home. And which we do at Jacaranda. Mara ya mwisho nilinyonyesha ni May 5th. Sijaona periods tena na all my 4 pregnancy tests are negative. So, had you used any family planning method at that point? And after delivery, your menses may be disruptive. That's right. It's better for you to get a family planning method. Can a high BP person deliver normal? Yes, you can deliver normal. You can deliver normal. Ensure that when you are going to deliver, you tell the people that you are hypertensive and you're taking this medication, because even for ASCAN, there's a time that you have to stop so that you go for delivery. Okay? I'm 32 weeks pregnant and I have a headache. Can I take mara moja? No, don't take mara moja. It has caffeine and it's not needed when you're pregnant. You can only take paracetamol or Cipladol, anything that has plain paracetamol, okay? 4 months pregnant na tumbo iko flat. Is the baby okay? People are different, that is one. We have different morphologies in terms of the type of pelvics that we have. So long as the scans are okay, you can do a scan. So long as the scans are okay, there's no problem. Dealing with ligament pain when pressed at 17 weeks. One of the things that can help is a prenatal massage that can help at least relieve the pelvic pressure, which we provide at Jacaranda Maternity through booking. So any of our branches, you call and then they'll book for you the day that will come for a prenatal massage. 10 weeks pregnant, not yet started antenatal clinic, and not taking pregnant care, come to our facilities, any of our facilities, either Ruaka, Ngong Road, Kahawa, Umoja. We start the clinics so that we start the antenatal supplements in advance. The reason because of this is because the supplements themselves are very important during the first trimester. Okay? Yes. And also there are tests that we usually do. And at the 12th week is when we are going to do something called a dating scan, just to say when you are going to deliver. So it's very important for you to come and we do all this. The antenatal profile, the, what do you call them? The supplements and the scan. They are very important at this particular point. Best family planning for a starter. So family planning differs from one person to another. So we usually advise on all the family planning services that we usually give, including short-term, long-term, or permanent. So it may be you want your kids to be spaced with a 3-year or 5-year gap. So there are things that we can advise you on. For example, for short-term, condom is also a family planning method. Oral medication like Femiplan, those are short-term, or the depot, those are short-term. You can stop at any time and get your fertility back at any time. Another thing for long-term, the list that you can get for long-term is the Implanon that you put under your arm for 3 years, 5 years, or even coil that are for 5 up to 10 years. So it's all dependent on the person. Can a person with high BP deliver normally? Yes, but in any eventuality that we see that this BP is endangering your life and the life of the baby, we may have to opt for early delivery and fast delivery. I hope you are being monitored with a gyna and a high-risk coordinator and a midwife closely. I have taken pregnant care for conception and no results. What else can I use so that I can help to get pregnant? There are many reasons for you, someone not getting pregnant. We really need to know and get to the bottom of why you're not getting pregnant. Is it that there's something else that is hindering you? So there are tests that you need to get, or there are scans that you need to do so that even if you're taking pregnant care, we at least know what might be the cause. Number two, we also need to you also need to know is that when your mind is unsettled, chances of you getting pregnant are low, because even the same hormones that are for your happiness, the same hormones that helps out with the pregnancy. So you need to relax, and nature will do its magic. For an anomaly scan, yes, we do anomaly scans, and even for people who are doing our clinics at Jacaranda, we usually schedule our anomaly scans from 20 to 24 weeks. Thank you. 6 weeks pregnant, can I take omeprazole for heartburn? We usually advise on the syrups first. So you can get a syrup, an antacid syrup first. 17 weeks pregnant, how do you deal with the painful ligaments? You can do a massage, antenatal massage. We do offer at Jacaranda, any of our branches. Just call in the branch that is near to you and they'll book you for that session. Or ligaments zinakumaliza, pole mami. Visit any of our branches so that at least you get to have a birth massage, antenatal massage. So we are currently we have 4 branches of Jacaranda Maternity. Kahawa West, that's our main branch. We have Umoja branch, Wallet Center in Ruaka near Roslyn petrol station, and in Ngong Road in between Greenhouse and Cuva Kilimani. PCOS can be related to fibroids. No, fibroids and PCOS are 2 different things. PCOS is more of a metabolic disorder. Fibroids, these are growths. Thank you so much for for joining our live. In case you have any concerns or any questions that you really need us to, they need to be answered by us, you can contact us through any of our social media pages. They also have numbers towards each and every branch that you have. For people who come to Ngong Road, you are very much welcome. I'm based in Ngong Road branch. And also, we also do laparoscopic procedures. Any laparoscopic procedure, be it a gyne-related laparoscopic procedure or other surgery-related laparoscopic procedures, you are very much welcome. Our gynes are available Monday to Friday from 8 to 4, all our branches, and Saturday varies from branch to branch. Even a pediatrician. For Ngong Road, our pediatrician is available on Tuesday, Wednesday, and Saturday, but GPs are available. Thank you so much. God bless you.